Good morning and welcome to another edition of Flathead Focus on Health. It's brought to you by Logan Health, advancing medicine and enhancing care. We're going to learn more about naturopathic oncology here this morning. We have Dr. Lynn Troy in the studios. And maybe for the listeners out there that have not heard that term, I have not heard that term before. What exactly is it and how does that kind of work alongside conventional cancer treatments like chemotherapy and radiation? Good morning.
Hi there. Well, naturopathic medicine is a system of medicine that combines safe and effective natural therapies with modern medicine. And in oncology, which is cancer care, we use naturopathic medicine to enhance survival and quality of life for people living with cancer.
And Logan Health is kind of unique in offering both a naturopathic oncology care. How does this support patients during active cancer treatment, especially when it comes to managing side effects and overall quality of life?
Logan Health is unique in offering naturopathic oncology. And currently, I'm the only naturopath that's board certified in oncology practicing in Montana. At Logan, we value collaboration and integrative care. We have an entire team with many specialists to support our cancer patients. I specifically use diet analysis, nutrition recommendations. I monitor patients for nutritional deficiencies, and I help them choose herbs and dietary supplements to maintain energy and well-being.
Now, you kind of touched on the next question is from a prevention standpoint, some everyday habits that people might have with nutrition and stress and sleep or movement, how can they reduce their chances of cancer?
Cancer is a preventable disease that requires major lifestyle changes. Prevention requires major lifestyle changes. There are very specific risk factors for cancer that involve our daily habits. And some of our habits increase risk, and some are protective. I like this topic because habits are something we can control. So importantly, avoiding using tobacco, limiting alcohol. Multiple types of cancer are linked to alcohol use, including breast cancer. And I really want women to hear this. We have a lot of breast cancer in the U.S. right now. Limiting red meat, processed meat, and fried food. The carnivore diet is wildly popular. And from a cancer perspective, it's not a healthy diet. Habits that go a long way to protect you, most importantly, would be exercise. Exercise improves insulin sensitivity, and this can help prevent diabetes, type 2 diabetes, alongside a healthy diet. People with type 2 diabetes have an increased risk of developing cancer. So maintaining a healthy weight, restricting calories, increasing fruits and vegetables and whole grains in your diet. Those are fiber. When we think of fruits and vegetables and whole grains, we think of fiber. Americans are typically not getting enough fiber, especially the young people. So also getting regular checkups and having screening and prevention exams is really important.
And we're speaking with Dr. Lynn Troy here this morning about naturopathic oncology. Maybe you can tell us how plant-based therapies can be used safely and responsibly in cancer care and prevention, especially under medical supervision.
Yes, botanical medicine can be a valuable source of support for cancer patients. It can boost immune activity, fight fatigue, and help manage pain. An example would be using American ginseng for fatigue during cancer treatment. Guidance is important here to avoid herb-drug interactions. An example of botanical medicine in cancer prevention is green tea or curcumin from turmeric. So including green tea as dietary beverage and adding your kitchen spice turmeric to your food is safe and can help prevent cancer. Sometimes we use those botanicals in stronger doses in capsules, which requires guidance from a naturopath.
And many people don't realize the connection between emotional health and physical health. How do stress, anxiety, and mental well-being play a role in cancer prevention and recovery?
I think this is important. Naturopaths practice caring for the whole person, body, mind, and spirit. And I hear this a lot from the patients. They often describe a period of extreme stress followed by a cancer diagnosis, and many say they feel this stress contributed to their cancer development. Some of the ways that could be happening: stress suppresses the immune system. Stress can increase risky behavior, such as coping with stress using more alcohol and tobacco, overeating, and getting less activity. It may be that the hormones involved with chronic stress may cause changes in the body that allow the development of cancer. We're not sure about that from a scientific perspective. This brings us back to exercise, which is one of the best things before, during, and after cancer treatment to reduce anxiety and depression. I also frequently recommend things like meditation, counseling, and art therapy.
And Doctor, I'm sure you've piqued some interest in some of our listeners out there. Where would you send them to get more information?
Well, if you're already a cancer patient at Logan, you certainly could ask any of your providers. You can call my direct line at 406-751-7560. I also want you to know that we have nutrition resources and classes. We have registered dietitian, some with classes starting in March. You can find information about that on logan.org.
Dr. Lynn Troy, Naturopathic Oncologist at Logan Health. Thank you so much, Doctor.
Thank you. It was a pleasure to be here.